Senate Bill number 2937, receiving 24 votes in the affirmative, 15 in the negative. I declare the bill passed. Take the usual course of passing bill. The taxpayers of this state just can't bear this cost anymore. You know, when health care was $8,000 a plan for a family plan and $10,000 for a family plan, I don't think anyone had a problem. The problem is when it's $19,000 for one police or firefighter, just one. The average pension and health care cost is $47,000 now. You know, it's going to go over 50 next year. So it comes a point in a time when, you know, I get it, but I also heard, you know, and some senators talked about how the teacher's health care plan was legislated. It wasn't negotiated. I mean, health care plan, not their pension. And in the health care plan was deductibles and everything else. So, you know, there's this big debate on, well, this is wrong, it's about collective bargaining. They can't say that in this House. Not when they've come to these legislative bodies to make changes year after year that they couldn't get at the bargaining table. When you do legislation like this, what happens is you don't define it and you don't explain it. I didn't explain it well, and it was defined as that we were going to just really make it hard on people to go out of state. It wasn't the case. We made it crystal clear how it works. You know, there's already out-of-network plans that exist. It's the family plan right now that costs $19,000. All this does is allows us, it basically says that each plan, you know, because there's single, there's 1+1, there's different plans in the state now. All this will do is allow us to create a in-state plan like Pennsylvania has that, you know, we're not sure whether it's going to save money or not. We've got to design it. But all it does is allow you to create one of these things. So I had to clarify. That's why we put a new bill to clean it up. You know, I didn't do a good job of explaining it, to be perfectly honest with you. Like how these things go, the unions latched onto this thing and said, you know, your child's not going to be able to go to CHOP.
What's the rationale for creating this new in-state plan?
Honestly, it's to try to get money back into the hospitals in New Jersey for one reason. We closed 19 of them. The state funds hospitals. You know, look, we closed 19 hospitals, throwing millions of dollars at them. How many thousands of union nurses have been laid off when these hospitals closed? How many orderlies and janitors have been laid off? You know, it's choose New Jersey. I actually find it offensive that people think New Jersey has substandard care. You know, we're the medicine chest, they say, of the world. We have the greatest research and healthcare and you know, people that provide, you know, development of pharmaceuticals in the world. So we're saying we're substandard to other places. You know, I just honestly feel that we should have something, and again, I say choose New Jersey. I think it's something that they should look towards, because the more we close hospitals, and normally we close them in poor areas. In North Jersey is where most of the hospitals are closed. Then you have an access of care for the people that don't have health insurance. So honestly, it was just trying to incentivize people to look into New Jersey, that's all. We have people in New Jersey that are actually overinsured to government employees too, that are overinsured. If I had taken government health insurance, which I don't, you know, maternity care, you know, that's a portion that's in there. I don't need that. You know, my children aren't children anymore. You know, they're grown. I don't need that. But right now I get this family plan that has all those things included. So what we're saying is create plans, multiple plans. And these boards, this is the thing that was important to me in my world, in the labor world that I live in, which is you know, I'm as union as anybody around. We have employees and employers, and they're equal numbers. No one has an advantage. And they negotiate ways to manage costs.
What did it feel like to stand up there as union members, both literally and figuratively, booed, hissed, looked down at you?
It breaks.
That has to be a moment.
I got to tell you, it broke my heart. Because I'm someone that cares about working people, has fought for working people his whole life. Look at the legislation that I've done. And for people to act the way they did was very, very disturbing to me personally. But it's the real world, and you deal with it. Like I said, I was very upset about it because the labor world that I was brought up in, we don't lie to our members. We tell them the truth.